Awesome. As people start to filter in, I just want to thank you so much for tuning into Manny's Super Civic Cyber Conversations. My name is Manny Akutiel, and I own a small business in San Francisco called Manny's at the corner of 16th and Valencia. We are a civic gathering and programming space, and we had to shut down on March 15th, which seems like 300 years ago. Because of the shelter-in-place order, and we decided we were going to bring our programming online, and that is what is happening right now, right here with this conversation with Trent Rhorer, who is the director of the Department of Human Services. Yes, the Human Services Agency. No, the Department of Human Services.
Human Services Agency, Manny.
I got it right. Oh, I got it wrong. The Human Services Agency. I got it wrong, then I got it right, then I second-guessed myself. Got it. Two quick notes. If you have a question for Trent, you can type it into the Q&A box at any time, and we'd be happy to read it out. So type your questions in the Q&A. And also, if you'd like to tag us, you can tag us at Welcome to Manny's. Trent, first I just want to ask how you're doing, because I feel like you have this big department, thousands of people. It's a really important department. It's doing a lot right now. How is your mental and emotional state through all this right now?
Appreciate you asking, Manny. It's funny when you activate this, and we now activate it on March 9th, the adrenaline kind of carries you for literally weeks. And what we've been at this now 6-7 weeks, and I can see it on the faces of my managers and my staff. And when I look in the mirror, we're tired.
Yeah.
Not only physically, but emotionally, mentally. These are big. It's a big system we're trying to put up, at the time of, as quick as we can responding to the crisis. And, once you take a breath and step back, you just realize that you're exhausted. But we're hanging in. This is why we do public service, right? I mean, it's the calling. And I can see the people working in the EOC, same people every day, putting in 12, 13-hour days, sometimes 7 days a week. So people are committed.
You've been doing this for a while, and you've led the agency since 2000, 20 years.
Mm-hmm.
We've been at the agency. No, you've been the director of the agency for 20 years. Why do you do what you do?
When I talk about it, I actually say I feel lucky that this mayor and other mayors have bestowed a humongous responsibility on me. I went to school to learn how to have government be more efficient, more effective, and I've dedicated my life to it. And to be in a position where I'm overseeing a department that serves 250,000 people every year, or the staff of 2,400, 2,500 people, doing everything from protecting kids from abuse and neglect to helping seniors and disabled adults stay at home through services in their homes. And in my role, you don't often see the impact, on the ground, right? You're making big policy decisions and budget decisions, et cetera. But, there are moments you sort of sit back and go, wow, we got 3,000 people into jobs this year. Or wow, we, reunified 150 children with their birth parents who are on a better place now. And, it's rewarding. I say in our new employee orientations, when I get to speak to people coming on, that I think the Human Services Agency is the most important city agency there is. We're helping the most vulnerable improve their lives. There's nothing more noble than that, I don't think.
Well, I hate to do this because I bet you've done this a gajillion times, but for those who are tuning in and maybe don't know exactly what the Human Services Agency does, can you just give us like a real quick kind of 30,000-foot overview?
Sure.
Because it does human services. It's like, isn't everything human services?
Right.
So
Well,
what are the 2,500 people doing? Exactly?
So it's the artifact. It used to be the Department of Social Services, and now we're all about humans. But so in simplest, highest level, it's birth to death if you are low income or otherwise in need. So that's pretty broad. But bringing it down to the level what we do. So all public benefits. We administer all the public benefit systems for single adults, families, children. So things like CalFresh, which used to be called food stamps, Medi-Cal enrollment, cash assistance, welfare to work. We're also a very large protection agency, so child protective services and adult protective services. We administer the foster care system. We also have, as part of the agency, which was actually formed in 2004 under then Mayor Newsom, we took the Department of Human Services and the Department of Aging and Adult Services, and put them under a single agency umbrella.
I see.
The idea of it was actually budget cut times, but create more efficiencies. We serve a lot of the same clients, whether on Medi-Cal, and they're also getting in-home care, things like that. And so a big piece of the Human Services Agency is the whole older adult and disability side.
Got it.
So 22,000 people receiving in-home care through IHS in-home supportive services, adult protective services, and then massive congregate feeding and home delivered meals and supports for seniors and disabled adults.
Wow. So your agency really is the agency that is serving the most vulnerable people in the city and county of San Francisco.
That is our mission. We do it through a $1 billion budget and about 2,500 employees.
Holy moly. I wanted to ask you about the budget cuts because I interviewed Ben Rosenfield last week and Ted Egan the week before. So I kind of got a double whammy. Also, both of those people are so entertaining. Love talking to them. And both of those conversations were really rough conversations, obviously. How do you think your department, which serves so many vulnerable people, might be affected by the shortfall?
Yeah. So it's interesting. The nature of the funding for public human services, sort of this kind of funding paradox that I talk about. So when times get bad, right, when you have a recession, we have massive unemployment, the need for our services increases significantly. Right. We've already seen, just looked at some charts this morning, a doubling of the number of people applying for CalFresh, for example, just in the last 6 weeks.
Wow.
So people need this safety net. They need the extra food support. They need the cash assistance. But at the same time, you have budget cuts, and every department has to submit their response to that reduction. And so how do you reconcile serving literally thousands of more people every month with fewer resources? And that's, fortunately or unfortunately, we've been through this before in 2008, 2009, when we saw significant cuts. And back then, and I hate, sort of, this is a crappy way to have to go about looking at your budget, but do the least harm possible.
Yeah.
Right.
Yeah.
So if it means people have to wait an extra half hour, 45 minutes to apply for their CalFresh benefits.
Yeah.
That's some of the trade-offs we have to look at, but it's going to be this budget deficit will be twice as big, I think, citywide than what we dealt with in 08, 09.
Mm-hmm.
When we were
some people do you feel like when I was a couple of years ago, I did a research project on food insecurity in San Francisco, and I talked to this very jolly man whose job is to get people to sign up for CalFresh. I don't remember his name. He was on the food insecurity task force. Loved him. Really great guy. And we sat down and we talked, and he talked about how only 50% of the people who are eligible for CalFresh actually apply in the city. And I'm wondering if you think that this crisis might actually change that mentality, where more people that actually can get these benefits are actually going to seek them. Are you seeing that?
Yeah, and the person you're talking about is Leo O'Farrell, I believe.
Yes, Leo. Oh my God, love him.
Yes, he has retired. I think that there's a couple things going on with CalFresh and enrollment now. We're way above the 50% now. We're probably more like closer to 70% in terms of uptake. And one of the reasons is an expansion of basically state eligibility expansion, allowing adults who are on SSI, so disabled adults and also older adults who are poor are now eligible for CalFresh.
Right.
And we've seen another 25 to 27,000 people enroll because of that. But I mean, you can look at see this top one?
Yeah.
So that represents the number of applications per week since the beginning of our activation, and this is last year. So the bottom line is last year, and then this is this year. So you're seeing more than double the number of people apply. Good and bad, right? Good in that people are availing themselves of a benefit they're eligible to receive, and it's you get it on the EBT card. It's just like an ATM card you can use in restaurants, farmers markets. The bad thing, of course, is that people are in extreme need right now.
And we have a nincompoop president who wants to cut CalFresh and food stamps and all that, and so it also we don't have a favorable administration to it. I have another question. which is about kind of collective empathy. So your department has been charged with helping people, the most needy, the most vulnerable, the aged, the children who need protective services, the hungry. And I think for a lot of San Francisco for the last 15 years has become a city, and the main, issue with us is this: we've become a city of have and have nots, and extreme wealth, extreme poverty. And I think it is easier to not have to really try to understand where you fit in the collective body, when everyone has the freedom to live and breathe and be however they want. But right now, we are being asked, a young, healthy bodied individual like myself is being asked to stay home, wear a mask, and do all these things to protect vulnerable parts of protect myself and my friends, but especially our vulnerable people. And so we're all being told to do and live in a certain way to protect vulnerable folks among us. How do you think that might change the way you maybe do your work, or how we think about our part in helping vulnerable people in our community?
That's an interesting question. One that requires you to kind of sit back and think a little bit. We haven't had a lot of that time lately.
You could just
the way that you here you go. the way that you put it though, Manny, I think is sort of elegant in that we're doing this. All of the work we're doing around hoteling, as an example, was to enable the hospitals to manage the medical surge, right? That was the initial, let's get folks out of the hospital, put them in quarantine so we can keep that flow. Now it's about, now that we've managed that to flatten that curve and we don't have that pressure in the healthcare system, we're still hoteling people because we want to stop community spread.
Yeah.
And we're picking people who are most vulnerable, age 60 and older, in health conditions, because we want to protect them. And your actions are precisely that, right? And so when you see people out on the beach, they don't understand, oh, hey, I'm healthy, no problem. But what they're not understanding is that they're putting their grandparents or their parents or whoever else at significant risk. And, one of the things you think might come of it is hey, given the nature of San Francisco over the last number of years and the significant increase in, the gap between incomes and wealth, maybe it'll cause people to take that step back and say, hey, we're all interconnected, and I did my part by staying at home for 6 weeks, 8 weeks, 10 weeks. What more can I do? And we are seeing a lot of people step up and volunteer. The Give to SF effort that
Great.
Is well over $10 million now, and hopefully that's a start.
Great. So let's talk about the hotel thing, because obviously it's on a lot of people's minds, and you're at the center of it. So I just want to give you, when the first interview I did about all this was Jeff Kaczynski, and we talked about how we may have an opportunity to really bring some folks inside. We talked to London Breed, and she talked, of course, about how she was also really excited about the potential with all these vacant hotel rooms to bring people into shelter for the first time in a long time. And also how once she learned the reality of what that would involve, and also the complicating factors, that it wasn't so simple. Interviewed Matt Haney and Hillary Ronan about their perspective on it, on why, even though it's not simple, it needs to be done. Interviewed Kevin Carroll from the Hotel Council about his perspective on behalf of the hotels. So I've had a lot of conversations about this. And you running the Human Services Agency, I wanted to get your take on it, and where you think the public may not have all the information. And I want to know what you think's been happening that brings you a lot of hope and that you're excited about, and what maybe you think you guys could have done better or could do better.
Yeah. There's a lot of questions in there.
There's three questions.
So the Human Services Agency, we are the lead agency for providing care and shelter in any disaster, right? Most typically we think of an earthquake, of course, but small activations like El Nino shelters, we would pop up for homeless, heat wave, things like that. So obviously under this activation, it's initially was hotel rooms to help manage the hospital surge, and now it's hotels to help manage community spread. I should say that it's the Human Services Agency. We do a lot of things. We have never stood up hotels, nor do we know how to manage or operate hotels, and yet that is what we're being asked to do. not an excuse by any means, but if you think about sort of getting public servants and a department to prop up a massive system of what's now 2,741 hotel rooms
Wow.
is an incredible undertaking. And um, if you compare, and we're not doing this to say we're better than everyone else, but sort of you can only benchmark with other cities, right? And we are going at a pace that is uh, much quicker than others. But it's interesting. We're on conversations with LA, for example. They're facing the exact same things we did.
Yeah.
Well, you get hotels to respond to an RFQ. You go ahead and you assess it. Looks good. You start negotiating. Then they bring in the ownership group that happens to be in New York, right? And then you have a long distance contract negotiation with city attorneys and real estate people, and these are not easy transactions,
Right.
and each one is its own, because each
Also, without
hotel
a
you're
lot
doing.
of precedent, probably.
Yeah, right. And we're getting better. We used to be sort of, from the time you assess a hotel, if that one's a good one to go, it would take probably 3 weeks to get that hotel online. So assessment, negotiation. Once we have it, then you got to do all the staffing, the supplies. You got to bring in DT for special data protection around, healthcare information for people. Just things you don't really think about. Arrange meals 3 times a day. And then the staffing, which is the biggest undertaking, bringing in city employees, then training them, having the right mix on site, and to serve what could be a challenging population, right? Individuals struggling with behavioral health issues and addiction, and others who aren't used to being inside. So we're now, probably from the time we sign a contract, we're now at about 3 days from a contract signing to getting a hotel open.
Wow.
LA, for example, still at about 8 days. So we're getting better. I think just the very sort of what I said at the beginning, the biggest challenge has been we're running hotels. The hotel staff by and large leaves, and we're getting.
Wait, so the hotel staff, can you tell me like what is happening? Like, how does this work? So
Yeah,
the city's like, okay, hotel, Manny's hotel. We want to lease your rooms for, are you giving them like a specific amount of time you're going to lease it for?
yeah. So it's hotel by hotel. The initial ask was 4 months, but each is subject to its own negotiation. Generally, they're all 3 to 4 months with options
Okay.
to extend.
Okay.
And then depending on the hotel size, some might keep staff. So a larger hotel might keep all their on-site staff. We'd love to have their kitchen staff stay so they can provide meals and keep, the economy humming a little bit, the
Mhm.
hospitality industry. It turns out that the hotels that are better suited for our needs are smaller, sort of between 80 and 100 rooms, just in
Mhm.
terms of managing a population, staffing configuration. And so typically the hotel would just say, basically hand you the property. And we would be bringing in people to manage the hotel's day-to-day operations with the guests that we have, which are all ours, of course,
Mhm.
and then arranging the meals, arranging the service staff and the like. So we are literally running hotels, um, which is,
Okay. Wow. And
an
and
undertaking.
and like if this was a shelter, and forgive me for not knowing all the ins and outs, but if this is a shelter, in a shelter people can come and go as they please, right? They can leave. They can leave there's no like specific hours, right?
By and large, some have curfews, but yeah, take a navigation center, for example. Yeah, that's much more, um, open-ended.
And so people come and go. Same
Mm-hmm.
thing with this hotel. So your people, there's no like security or people like watching what people do at all. It's just
So there are. We have site monitors, we have site managers, so someone overseeing the whole staff deployment at the site. We have behavioral health clinicians
right.
that rotate through, medical doctors as well, nurses, and then sort of the people on site who are interacting with folks many times a day.
Got it.
So 3 meals a day, dropping at the door, multiple check-ins. They're encouraged to stay in their room, right? I mean, we're talking about managing community spread.
Right. Because that's
Different hotels might have different rules about when people can go out. Some need to go out and have a smoke. That's fine. It's sort of managing within
yeah.
that context. But we certainly don't want people who are quarantined to be circulating around the neighborhood. And
Yeah.
by and large, that is not happening. They're
So
staying in their rooms.
how's it going? Like you have, so there's 2714 rooms, right?
2,741.
Damn, I'm getting everything wrong. 2741. How
Yep.
many of those are occupied? And like in those rooms that are occupied, like, yeah, how's it going? How is
Yep.
it so far?
So we have 936 rooms for first responders at two hotel sites, but the ones that are really that we focus on are the folks for vulnerable populations, homeless from the street, shelters, and also quarantine for COVID positive. We have 1,805 rooms under contract. Right now, as of, I get a report every morning. This morning, there were only 880 people in those rooms. So you might ask, wow, you have 1,800 rooms under lease, but only 880. Why is that? We had 532 rooms brought on under contract over the last 5 days. So those 532 right now are beginning to be supplied, staffing, resources, and the like. And then rooms turn over also. So as folks get healthy past COVID, they are given an option to go to a congregate shelter, and then that room is turned over for other folks.
Mm-hmm.
And so it takes, a couple of days. You got to do the cleaning, you got to do the, sort of resupply up all the rooms
Mm-hmm.
and that sort of thing. So once we're at steady state, which means we're not bringing any more hotels if we're ever at that, when we'll have several thousand, they'll be run 92, 95% occupancy to account for turnover. But
Yeah, I mean, that would stress me out as just someone that like penny pinches in all aspects of my life. Knowing that I had 1,000 rooms that I was paying for that weren't filled, I'd be like wanting to get those filled as soon as possible. So
absolutely.
I know that you are trying to get those extra 1,000 rooms filled as soon as possible. Like, what is the hardest part about getting people into those rooms?
Yeah. So I should say that the way we're structuring the agreement, we don't pay on day one of the contract. We lag it. It's actually the fourth day
Oh, good.
to allow us to, yeah.
Nice. Oh, good.
And the federal government is picking up 75% of the costs for
Right.
vulnerable populations, as you know. So the flow, I think the most challenging, and the Department of Homelessness and Supportive Housing has the lead for moving individuals from the street into hotels. That's a slow pace. The first hotel we did, they did 20 at a time. So 20 people, and kind of rather than taking, 80, 90, 100 people, putting them right on site, it just makes it more stable, easier to operate. But, we've been doing this work of trying to get folks into housing, right, forever, for at least for 20 years since I've been director. And it takes time for individuals, even in normal times, to get into housing, right? You do outreach on the street. Some people might be reluctant. You have to build up that trust. They might have a community of folks they rely on the street, and moving indoors can be challenging. And people are sometimes afraid to leave where they've been comfortable for a period of time. I have to say our outreach workers are doing a fantastic job.
Mm-hmm.
We got those first 51 units up in filled in 3 days. So they've created these relationships and it's working. But deployment from transportation, you got to do a few people at a time, to making sure they have all of their stuff, and do they need special medications, and they need sort of assessing what the proper setting would be for them. Is it more of a behavioral health orientation or more of a medical orientation? Just kind of all of that, person by person, and trying to fill 1,000 rooms in that way.
Right. I'm gonna have I have two more questions, and then folks, if you have questions for Trent, Director Rhorer, I guess.
Call me Trent.
I have that name, Director Rhorer. I just feel like it's made for a movie. But I'm gonna call you Trent.
Thank you.
The question that I think is on so many advocates' minds is, this might be a great opportunity to permanently house these people, right? I mean, I can only imagine if someone has gotten comfortable and you've done this work getting them into a room, to then have to take them out of a room and bring them back to the street would just be heart-wrenching. So are you optimistic at all that there might be some people who could stay in these rooms?
I am. It's important. The mayor says this a lot at her press conferences, and I've said it as well, is we want to solve the homeless crisis, right? We want everyone to be housed. That's what we believe in. It's, everyone deserves a place to live, whether you have zero income or $1 million a year. but you have to keep in mind that this is a public health activation, and we need to be doing what's best for the interest of the public's health, right? Which is focusing on vulnerable populations, focusing on older, decreasing community spread, managing the surges in the hospitals.
Yeah.
And which is what, DPH is guiding sort of all of our activations through that public health lens. But having said that, absolutely, we are hoping that some of the hotels that we're currently under contract, and we have 19 of them now, would want to enter in a longer term arrangement with the city. Whether it's a longer term lease, whether it's opportunities to purchase. I know that the city of Oakland have been in touch with Mayor Schaaf and her staff. They're looking to do the same thing. I think some of the smaller hotels might lend themselves better to that. Your 40 or 50 room hotels, motor inns, whatever.
Yeah.
And I think we saw this when we leased SROs, when we started, in early 2000s, that, you get the NIMBYism and they go, I don't want a homeless next door to me. And what we saw when we put homeless individuals in SROs surrounded with services and support, those buildings were under better operation than a hotel or an SRO that was in private, right?
Yeah.
That was more run down, that had illicit activity going on. And, I'm hoping that our neighbors, recognize that when they see, oh, wow, this hotel is filled with homeless people, wouldn't know.
Yeah.
And I think that's an important, you talked about sort of what I'm hoping people, when they shelter in place, might they get some altruistic bent, but, I'm hoping that this demystifies homeless individuals, right? There's reasons people are homeless, and mostly it has to do with income, right? And some has to do with other issues that they have that's related to being very poor. But, I think we have proven that when you can house people and it's safe to the neighbors, and it's doing it with dignity and care for people. And we are very much hoping that some of our hotel owners enter into long-term arrangements with us.
Great. Well, that would be amazing, and a bright spot to come out of all this, I think.
Mm-hmm.
Let's get to some of these questions that were written in. Mayor Breed brought up today in her press conference that one of the challenges in addressing infection control during COVID-19 is severe behavioral health issues that cannot be adequately managed in the current structure of quarantine and isolation rooms. What do you propose to give our neighbors with behavioral health issues the support they need to keep us all safe?
Thanks for that question. What we're trying to do is create a range of alternatives for we call it care and shelter, right, in its broadest terms. So those could be hotel rooms, but they also could be a congregate, what we're calling sort of I hate to use the word medical shelter because it's not a field hospital, but it's a congregate setting for people who are COVID positive, who need more supervision, for whom closing a door in a hotel room may not be in that person's best interest health-wise. And I would imagine a lot of the COVID positive people who end up going in that congregate setting would be those with behavioral health needs, significant behavioral health needs, but also medical needs as well, where they need a more monitoring. And this is a lesson learned from Boston as well as Seattle. We're on calls over the weekend where we can breathe with some kind of learning best practices. And those are sort of some of the ideas. We're opening up an RV and a site for 20 or 120 RVs and trailers. And that might be for folks who might do better in a little lower threshold setting like that rather than a hotel room. So kind of creating ranges of exits for the entire population.
Great. Tammy Bryan, are pets an obstacle for people to accept the hotel rooms? If so,
hi, Tammy. Tammy works for me.
Oh, hi, Tammy.
It's a valued HSA employee. So what was the question? Pets? Yes, we are making accommodation for pets for sure. Animal Care and Control is our partner with us for all of these shelter activations. So we don't want people's pets to be a barrier, similar like in the navigation centers where they're not a barrier.
Got it. Roshan, Trent, thanks for all the work you're doing. I've heard that more folks are getting released from jail who are in the pretrial process. Some might be currently experiencing homelessness or don't have a safe home to get back to. Are you guys working to get those residents housed in the rooms you have open? Also, outside the chart you shared on CalFresh, what are some key uses of data that have helped HSA in serving SF residents?
Let's do the last one first. So we do, like I said, we serve 250,000 San Franciscans every year, right? And a big piece of that is our benefit programs. When we March 6th was a Friday, and when it was becoming increasingly clear that we were going to move towards a shelter in place, they immediately said, you know what, we're closing all of our welfare offices, all of our service centers to the public. We didn't want people crowded in lobbies. It wasn't a healthy environment. So what does that mean? That means that 90% of my staff are working telecommuting. They're actually doing the benefit processing from their home. And so to your point around data, I get a daily dashboard that shows sort of the efficiency of being able to do that.
Yeah.
And our call wait times, our application processing timeframes are very, very similar to what they were prior to the telecommuting.
Great.
Which suggests that people are getting the services that they need and using data to monitor that. What was the other question? Was more on hotels?
From jail. Folks came
Post jail. Yeah. So if someone is being released from jail and they fall into a vulnerable population over age 60 or underlying health condition, we would want them to be in queue for the hotel rooms as well. And certainly if they are COVID positive or showing symptoms, we would want them to be in a quarantine room.
Got it. Question about Raphael's proposal to have folks be in the Everett Middle School parking lot. Do you think parking lots are a good potential, another tool in the tool belt?
You know, again, we're talking about a public health activation, right? And to the extent that we can spread people out who are on the street and who are bunched up in tents that are right next to each other, some cases not in tents, I think it's an alternative worth exploring. Jeff Kaczynski and the Healthy Streets Operations Committee is lead on looking at, we're calling them safe sleep sites. Say that 3 times fast.
Safe sleeps. You know, I had a lisp actually, and I had to go to speech therapist in 2nd grade. So she'll be very proud.
Safe sleep site. I can't say it. Anyway, we're looking at that for our unhoused residents to be able to better distance and be able to limit that community spread.
Nice. All right. My final question is, behind you there hangs a 2012 World Champions poster. Where were you on the night that the Giants won the World Championship?
Which one? 10, 12, and 14?
The one behind you.
That was, what was that? That was 12?
Yeah, right behind you.
That was 12. God, they all run together. Was that the one where we beat Kansas City, or was that the one where we beat
I don't remember.
Detroit? I think it was Detroit.
I remember because it was the first year I moved here, but I don't remember who it was against.
I know I wasn't at AT&T Park because we won it on the road, but I'm sure I was at my favorite watering hole with my friends celebrating.
What would that have been? What was your favorite run? Why not?
I actually live in Oakland. It's a bar called McNally's Pub. It's an
Nice.
Irish bar that's been around since 1932, I believe.
Nice.
There's a little plug for McNally's.
Well, I hope McNally's Pub can open once this is all past us and come back swinging. Trent, you have a hard job. You're working really hard. I know you and I were chatting in the pre-call that you and a lot of the other department heads and all the folks working at the departments are pulling long hours, 7 days a week, fighting very, very hard for the residents of this city. And I want to send you strength and thank you for all of your hard work. I want to quickly also, for those who are on the call, if you go to the chat box or you look at the link above my head, it's joinit.org/o/Manny's. We're asking everyone that's joining these calls to please, please, please consider becoming a sponsor of Manny's, my small business. It's $36 a month, and it's the way that we're going to make it through this really difficult time. It's going to be a long and slow recovery for spaces like mine that are gathering spaces. And so the only way that we're going to make it through this is if we have a community of people sponsoring us. So it's $36 a month. The link is in the chat box, everyone. Please click on it. You can cancel anytime if you need to, but I hope you don't. And you can go to joinit.org/o/Manny's. Really, really appreciate it. We have a big goal to have 36 new sponsors by the end of the week to help us through this. So thank you so much, everyone, for tuning in. Thank you to Ram, Sam, and Jupiter for making this call happen. And Trent, I want to give you the final word.
I appreciate being on, Manny. This is a marathon and a sprint, I like to say. And you know, one of the questions I thought you were going to ask was about the city partners, and I tell you what, this city, people have really stepped up. I mean, and come together, and you have a chance, man, to go down to the EOC, Emergency Operations Center, you'll see that thing buzzing. We got hundreds of city employees there every day working on this activation. And I think the city's in really good hands. And Mayor Breed has provided exceptional leadership as well. So we're lucky.
Well, thank you very much for that update. I should also just say that you are the 100th conversation we've done in this series. So you're number 100.
Woohoo.
All right. Bye, Trent.
All right.
Thank you so much.
All right. Come back soon.
All right.
Take
Bye.